1. A 56-year-old client is receiving chemotherapy that has the potential to cause pulmonary toxicity. Which of the following symptoms indicates a toxic response to the chemotherapy? A. Decrease in appetite. B. Drowsiness. C. Spasms of the diaphragm. D. Cough and shortness of breath. Answer. D. Cough and shortness of breath. Reason: cough and shortness of breath are significant symptoms because they may indicate decreasing pulmonary function secondary to drug toxicity. Decrease in appetite, difficulty in thinking clearly, and spasms of the diaphragm may occur as a result of chemotherapy. However, they are not indicative of pulmonary toxicity. 2. After surgery for an ileal conduit, the nurse should closely assess the client for the occurrence of which of the following complications related to pelvic surgery? A. Peritonitis. B. Thrombophlebitis. C. Ascites. D. Inguinal hernia. Answer. B. Thrombophlebitis. Reason: after pelvic surgery, there is an increased chance of thrombophlebitis owing to the pelvic manipulation that can interfere with circulation and promote venous stasis. Peritonitis is a potential complication of any abdominal surgery, not just pelvic surgery. Ascites is most frequently an indication of liver disease. Inguinal hernia may be caused by an increase in intra-abdominal pressure or a congenital weakness of the abdominal wall. Ventral hernia occurs at the site of a previous abdominal incision. 3. A nurse is conducting an initial assessment on a client with possible tuberculosis. Which assessment finding indicates a risk factor for tuberculosis? A. The client sees his physician for a checkup yearly. B. The client has never traveled outside of the country. C. The client did a liver transplant 2 years ago. D. The client works in a healthcare insurance office. Answer. C. The client had a liver transplant 2 years ago. Reason: a history of immunocompromised status, such as that which occurs with liver transplantation, places the client at a higher risk for contracting tuberculosis. Other risk factors include inadequate health care, traveling to countries with high rates of tuberculosis, such as Southeastern Asia, Africa, and Latin America, being a healthcare worker who performs procedures in which exposure to respiratory secretions is likely, and being institutionalized. 4. When obtaining the vital signs of a client with multiple traumatic injuries, a nurse detects bradycardia, bradypnea, and systolic hypertension. The nurse must notify the physician immediately because these findings may reflect which complication? A shock. B. Encephalitis. C. Increased intracranial pressure, ICP. D. Status epilepticus. Answer. C. Increased intracranial pressure, ICP. Reason: when ICP increases, Cushing's triad may develop, which involves decreased heart and respiratory rates and increased systolic blood pressure. Shock typically causes tachycardia, tachypnea, and hypertension. In encephalitis, the temperature rises and the heart and respiratory rates may increase from the effects of fever on the metabolic rate. If the client doesn't maintain adequate hydration, hypertension may occur. Status epilepticus causes unceasing seizures, not changes in vital signs. 5. A nurse is caring for a client with poorly managed diabetes mellitus who has a serious foot ulcer. When she informs him that the physician has ordered a wound care nurse to examine his foot, the client asks why he should see anyone other than this nurse. He states, "It's no big deal. I'll keep it covered and put antibiotic ointment on it." What is the nurse's best response? A. We're very concerned about your foot and we want to provide the best possible care for you. B. This is a big deal and you need to recognize how serious it is. C. This is the physician's recommendation. The wound care nurse will see you today. D. You could lose your foot if you don't see the wound care nurse. Answer. A. We're very concerned about your foot and we want to provide the best possible care for you. Reason: the client's response indicates that he's in denial and needs further insight and education about his condition. Letting the client know that the nurse has his best interests in mind helps him accept the wound care nurse. Although telling the client that his condition is serious and that the wound care nurse will see him that day are true statements, they're much too direct and may increase client resistance. Telling the client he could lose his foot is inappropriate and isn't therapeutic communication. 6. A client with inflammatory bowel disease is receiving total parenteral nutrition, TPN. The basic component of the client's TPN solution is most likely to be A. An isotonic dextrose solution. B. A hypertonic dextrose solution. C. A hypotonic dextrose solution. D. A colloidal dextrose solution. Answer. B. A hypertonic dextrose solution. Reason: the TPN solution is usually a hypertonic dextrose solution. The greater the concentration of dextrose in solution, the greater the tonicity. Hypertonic dextrose solutions are used to meet the body's calorie demands in a volume of fluid that will not overload the cardiovascular system. An isotonic dextrose solution, for example, 5% dextrose in water, or a hypotonic dextrose solution will not provide enough calories to meet metabolic needs. Colloids are plasma expanders and blood products and are not used in TPN. 7. While assessing a male neonate whose mother desires him to be circumcised, the nurse observes that the neonate's urinary meatus appears to be located on the ventral surface of the penis. The primary health care provider is notified because the nurse suspects which of the following? A. Phimosis. B. Hydrocele. C. Epispadias. D. Hypospadias. Answer. D. Hypospadias. Reason: the condition in which the urinary meatus is located on the ventral surface of the penis, termed hypospadias, occurs in 1 of every 500 male infants. Circumcision is delayed until the condition is corrected surgically, usually between 6 and 12 months of age. Phimosis is an inability to retract the prepuce at an age when it should be retractable or by age 3 years. Phimosis may necessitate circumcision or surgical intervention. Hydrocele is a painless swelling of the scrotum that is common in neonates. It is not a contraindication for circumcision. Epispadias occurs when the urinary meatus is located on the dorsal surface of the penis. It is extremely rare and is commonly associated with bladder exstrophy. 8. While assessing the fundus of a multiparous client on the first postpartum day, the nurse performs hand washing and dons clean gloves. Which of the following should the nurse do next? A. Place the non-dominant hand above the symphysis pubis and the dominant hand at the umbilicus. B. Ask the client to assume a side-lying position with the knees flexed. C. Perform massage vigorously at the level of the umbilicus if the fundus feels boggy. D. Place the client on a bedpan in case the uterine palpation stimulates the client to void. Answer. A. Place the non-dominant hand above the symphysis pubis and the dominant hand at the umbilicus. Reason: the nurse should place the non-dominant hand above the symphysis pubis and the dominant hand at the umbilicus to palpate the fundus. This prevents uterine inversion and trauma, which can be very painful to the client. The nurse should ask the client to assume a supine, not side-lying, position with the knees flexed. The fundus can be palpated in this position and the perineal pads can be evaluated for lochior mounds. The fundus should be massaged gently if the fundus feels boggy. Vigorous massaging may fatigue the uterus and cause it to become firm and then boggy again. The nurse should ask the client to void before fundal evaluation. A full bladder can cause discomfort to the client, the uterus to be deviated to one side, and postpartum hemorrhage. 9. A multigravid client in labor at 38 weeks gestation has been diagnosed with Rh sensitization and probable fetal high drops and anemia. When the nurse observes the fetal heart rate pattern on the monitor, which of the following patterns is most likely? A. Early deceleration pattern. B. Sinusoidal pattern. C. Variable deceleration pattern. D. Late deceleration pattern. Answer. B. Sinusoidal pattern. Reason: The fetal heart rate of a multipara diagnosed with Rh sensitization and probable fetal hydrops and anemia will most likely demonstrate a sinusoidal pattern that resembles a sine wave. It has been hypothesized that this pattern reflects an absence of autonomic nervous control over the fetal heart rate resulting from severe hypoxia. This client will most likely require a cesarean delivery to improve the fetal outcome. Early decelerations are associated with head compression, variable decelerations are associated with cord compression, and later decelerations are associated with poor placental perfusion. 10. The mother of a client with chronic undifferentiated schizophrenia calls the visiting nurse in the outpatient clinic to report that her daughter has not answered the phone in 10 days. She was doing so well for months. I don't know what's wrong. I'm worried. Which of the following responses by the nurse is most appropriate? A. Maybe she's just mad at you. Did you have an argument? B. She may have stopped taking her medications. I'll check on her. C. Don't worry about this. It happens sometimes. D. Go over to her apartment and see what's going on. Answer. B. She may have stopped taking her medications. I'll check on her. Reason: non-compliance with medications is common in the client with chronic undifferentiated schizophrenia. The nurse has the responsibility to assess this situation. Asking the mother if they've argued or if the client is mad at the mother or telling the mother to go over to the apartment and see what's going on places the blame and responsibility on the mother and therefore is inappropriate. Telling the mother not to worry ignores the seriousness of the client's symptoms.